According to the National Alliance on Mental Health, about 21 million U.S. adults have a major depressive episode every year. Not everyone chooses to get help, but today, U.S. Senator John Fetterman did.
His family announced he checked himself into Walter Reed Medical Center. That's in Washington, D.C. Pittsburgh Action News 4 reporter Kaylee Gunderson joins us live with what mental health experts are saying about this tonight. Kaylee.
Chris and Mike, mental health experts I talked to tonight say that it is common for people in these high-stress, very public roles to experience mental health struggles. But they say, unfortunately, it's uncommon that they will advocate publicly for their own mental health and seek help like Senator John Fetterman is doing now. United States Senator John Fetterman is hospitalized for the second time this month, this time seeking inpatient treatment for clinical depression at Walter Reed in Washington, D.C. His office sharing a statement saying in part, while John has experienced depression off and on throughout his life, it only became severe in recent weeks.
The vast majority of people with depression are treated as outpatients. Only 10% are inpatient, and it's a short term. It's not a long-term admission.
Psychologist Paul Friday not directly commenting on Fetterman's treatment, but saying inpatient treatment is highly effective.
Treatments are so exquisitely tailor-made for each individual problem that being admitted to a hospital is really a good sign. It's not a bad sign. It's a sign that you are strong and that you're doing something to help yourself.
Clinical therapist Tom Longenecker said clinical depression can be challenging to treat through outpatient care.
One of the key things that major depression does, it really withers away at a person's imagination. And it's very difficult to treat this at an outpatient level. It can be done, certainly, but inpatient treatment does permit a person to be able to focus much more on highlighting their mental health.
23 million Americans are placed in a hospital every year. This is not a unique, solitary thing. This is very common.
Yet still stigmatized.
I am sure by no means is he a minority in terms of being in a position such as he is in and having these kind of struggles. What he is a minority in is as somebody who's willing to be public about addressing his mental health and advocating for his own health.
And often the signs of clinical depression are not obvious to close friends and family, but if you are experiencing depression, you can seek help. We have some resources available on this story on our WTAE app. Reporting live tonight on the North Shore, Kaylee Gunderson, Pittsburgh's Action News.